I would like to emphasize that the CCO system is a system, first of all, that integrates a self-ligating appliance, interactive, with a prescription that is devoted for finishing, and also integrate a set of sophisticated bioactive and stainless steel arch wires, and more importantly, all of these with a specific goal-oriented sequence. So a CCO is not just a bracket, it's not just a prescription, is basically the integration of all of that in a specific sequence that will allow you to solve, as you will see, most of the cases that you have in a pretty I would say efficiently way. So let me start by defining the 3 stages of mechanics. Basically, stage 1, leveling and aligning, the working stage and finishing stage. And I would like to also specify that we have some goals that we want to achieve at each one of these stages. And based on the goals that we want, we will use the specific wires that we will allow us to achieve those goals. So as you can see here, in stage number 1, we want to correct all the rotations, correct all the tipping, correct the alignment, and start leveling the arches. Stage number 2, we want to level the occlusal plane. We want to coordinate the arches. We want to consolidate all the spaces that we have. And we want to basically correct the sagittal, the vertical, and the transverse problems that we have, at least dentally. And in the finishing stage, we want to fine-tune tooth position and improve intercuspation. Right now, we have wires that actually introduce different forces at different part of the wires. So they have more force in the molars than in the incisors. So gradually, they express more force along the wires, keeping the same super elasticity, and of course, they're heat activated. Not only we have square wires like the 2020, but also right now we have round wires that they work with this technology. So these wires are amazing. We have a bracket that is interactive. It's not active, it's not passive, it's interactive. And the interactivity means that that clip can be passive or active based on the malocclusions, based on how the wire relates to the clip, and also can be active or passive based on the size of the wire. The wire can easily slide through the brackets and tubes as the wires recover its shape with the thermoelasticity, and that makes that the interbracket distances decreases as alignment improves. That's why it's not rare that you can have severe crowding in some cases with extraction or without extraction sometimes. And if you have enough space to align those teeth, to let the wire to go back to its original form and shape, the wire can start moving these teeth into the space, and the wire will slide through the tubes and the bracket without problems, reducing and in sometimes eliminating the secondary effect that you see in many systems that they don't have these properties. So we manage the arch perimeter by allowing the interbracket distances to change without causing secondary effects. So this is key. That's why we can sometimes see cases like this one with moderate to severe crowding. We can put the 014 initial wire, and we can let the case go for 8 or 10 weeks or even more. And by the time the case go back to the next arch wire, the teeth are aligned and you don't see any secondary effects. You don't see the teeth blowing like we used to worry about it. I mean, 15 years ago, you just see the alignment getting better.